Hello, I'm Joan Elder, the Grant Coordinator for Community Health Foundation. This session should prepare you to submit a complete grant application. I will cover the history and purpose of Community Health Foundation and how we define community health. We'll review the resources you'll need, the grant guidelines, the grant application, and a budget. And I'll explain the process that we use to review grant proposals. So, what is Community Health Foundation? We are the surviving entity of the Community Hospital Health System in Springfield, Ohio. Our purpose is to represent local interests to the regional health system and to provide services for medical procedures and treatments that are not permitted by the ethical and religious directives of the Catholic health system. We are a corporate member of the local Mercy Health System, a parent company, and 50% owner. We serve health-related interests in Clark and Champaign counties, Ohio. We recognize that health services are necessary, but not sufficient to meet the community needs. Our mission calls for grant making as a way to make a difference in our community's health and well-being. We rely on nonprofits like yours to help advance our mission for wellness in the community. To qualify for a grant, your organization must meet these basic requirements. You must be a nonprofit, conduct business without discrimination, serve residents in Clark and/or Champaign County, Ohio, and support health and wellness for our residents. We view health through a broad lens. Health services are necessary but not sufficient to support wellness for everyone. In this graph, you can see that health outcomes are influenced by many systems, 80% of which are outside the clinical setting. The numbers in the labels shaped like the state of Ohio represent Ohio's health ranking for each indicator when compared to other states in the country. Unfortunately, we are near the bottom of the ranking for physical environment and public health and prevention. Our grant priorities are guided by the community health assessments of the two counties we serve. The most recent community health assessments were completed in 2019 and introduced in 2020. This slide and the next give an overview of the two counties' health assessments. Both counties identified priority areas in mental health and substance use, chronic disease prevention and management, and maternal infant health. More information is available at the respective websites. As indicated by the green health equity section on each of these charts, we are concerned about everyone having a fair and just opportunity to be as healthy as possible. We recognize that disparities in society can create barriers to wellness due to a person's race, ethnicity, neighborhood of residence, disability, or financial status. Our priority areas reflect the items identified by the community health improvement plans in the counties we serve: healthy living, mental, emotional health and substance abuse, reproductive health, and safety net services. You may find that your organization or program addresses more than one of these impact areas, and that's okay. Grants are awarded for one-year terms. Your organization may apply for the same program in subsequent years. So, what programs has CHF funded in the past? Over the years, we have provided 193 responsive grants to 52 different organizations for a total of $1.46 million. You can find this comprehensive report on our website. Because our board believes strongly in the importance of responding to the needs of the community, grant dollars have increased over time. In 2014, our first year of awarding grants, we issued just over $67,000. This amount has grown to $240,000 in 2020. And this trend continues, with $250,000 allocated to grants for this fiscal year. The general range of grant awards is $2,000 to $10,000, but occasionally we'll award larger or smaller amounts. I hope you'll take time to review the lists of prior grants on our website. This will help you gauge the fit of your program and the dollar amount you're requesting. We also provide opportunities for mini grants of $1,000 or less throughout the year as your needs arise. Contact me at jelder@mercy.com if you're interested in more information about these smaller grants. The grant application and other supporting documents are available on the Community Health Foundation website under the Grants tab. I hope you've had a chance to look at our website. If you haven't, please review the grant guidelines before you start working on the application. These are the documents on our website which you'll need to complete your application: the grant guidelines, the grant application, and the budget. The guidelines give clear instructions about our expectations. Let's review the application and the budget. The grant application is housed on a separate site called smarterselect.com. The program works best in Google or Firefox. The first time you go to the website, you will create a username and password. You can view and print the application before you start filling it out. You can save your work and return to the application at a later time. Just remember to scroll to the bottom of the page to save each time. Be sure to answer every question. Enter NA or not applicable if it doesn't pertain to your program. I recommend typing your answers in a Word program first, then copy and paste into the online application. This gives you a chance to verify your spelling and grammar and word counts. Be sure to proofread your application and ask a friend to review it also before you submit it. This is a grant budget format that we provide in an Excel format. It is a separate document that must be completed and attached to your application. We expect to see a program budget, not an organizational budget. The revenue support page should show the sources of income for your program, including the grant amount you're requesting from CHF. We do not want to be your only funder, so we'll look for all sources of revenue for the program. The expenses page will show how you have budgeted your available funds. The revenue and expenses should equal the same amount and be the same as the project and program budget on the first page of your grant application. You may use your organization's budget format if you prefer, but please address the appropriate line items which are listed in these documents. Once submitted, grant applications are reviewed by myself and a grant committee of 12 community members. We read every application. Applications are judged on their fit with our priorities, the organization's ability to be successful, and the value of the program to our community. We prefer to fund programs that are evidence-based, effective, or promising. We are not likely to fund startup organizations or brand new, unproven programming. We're restricted in the number and amount of grants by the dollar amounts available for the funding cycle. The committee has to make hard choices. An application could be fully funded, partially funded, or declined. Grant letters will go out to inform every applicant of our decision. If you want feedback on your application, contact me after receiving your letter. If you are awarded a grant, there are reporting requirements during the year. Most grants require an interim report on January 31st, and all must submit a final report by July 31st. If these reporting requirements aren't met, you may not be eligible for grants in future years. During a grant year, you can expect a request for a site visit or a meeting to discuss the progress of your program. We do not ask for a letter of intent. The completed grant application is due by the end of the day on January 29, 2021. After submitting your grant, you probably won't hear from us for about 3 months. After review, the committee's recommendations are sent to the board for approval during their April meeting. You'll be notified of our decisions in late April or early May. Grant checks are mailed by June 30th after we receive your signed grant agreement. The granted funds may be used during the fiscal year, which starts July 1st and ends June 30th. I'm often asked certain questions during a grant information session, and so I'd like to address some of those right now. If yours is a new organization and not yet been approved for nonprofit status, you may still apply for a grant by utilizing a fiscal sponsor. We ask in the application for you to tell us how you are addressing issues of equity. And we would like to know what your organization is doing, whether it could be a board policy, a diverse and inclusive board and or staff, or a program that's designed with input from those with lived experience. And sometimes folks want to know when it's appropriate to apply for an organizational grant rather than for a program or project. Organizational grants are most appropriate for small nonprofits that have one main program. If you have any problems accessing the application or need special assistance, please contact me, and I'd be glad to answer any other questions that you have. My email address is jelder@mercy.com, and my phone number is 937-523-7007. Be aware that the grant deadline is Friday, January 29, 2021 by 5 p.m. Late applications will not be accepted. Thank you for your interest, and I look forward to seeing your completed grant application.